Hi, this is Dr. David Klein at the Stages of Life Medical Institute in sunny, maybe rainy, Central Florida. What I'm going to discuss right now is what can you expect when you return to work? Not if, but when, and it's going to be fairly soon, at least in these warm climates. What you can expect is this. Different habits now have emerged. There are going to be different ways that you're going to interact with the people around you. And we're going to see more and more social distancing. Now, why is this going to be important? Because even if you return to work next week or the week after, there's still going to be cases of COVID flying around. So the last thing that you want to do is to drop your guard at the last minute. Is a 6-foot barrier between you and the next person adequate? And the answer is probably so, unless you're on the inside of a taxi cab, okay, which is a problem, okay, especially for Uber drivers. What you're going to find is that people are going to stand back from you. And this is probably not a bad thing, not for a while yet. Now, this is not the first epidemic we've had. We've had them on a regular basis, on an annual basis, if not more frequently. So are we going to see people shaking hands in the near future? Probably not, at least not to the same extent. It'll be a little bit more of a macho kind of a deal to see who can have the tighter hand grip. But the fact of the matter is that the handshake is driven largely from let's say a custom that showed that you didn't have anything in your sword hand. Okay, and most people are right-handed, so you stuck your right hand out, meant you were unarmed. I'm left-handed. I would have carried my sword on the other side. You would have been toast. What about lunchroom etiquette? Okay, this is also going to change. So are we going to necessarily be sitting close to each other in the galley, as we used to call it in the Navy, as we call it here in the office, we call it the galley? Are you necessarily going to be in close proximity? And the answer is probably not for a few more months. So bring your lunch if you're smart. Why? Because you don't want other people handling your food. That's what got the people into trouble in those nursing homes and on the cruise ships, was foodborne. It really hasn't made the news yet, but it will eventually, and we will all be bored of it when it does. But be very, very wary of people handling your food, your eating instruments, your plates, and whatnot. So be very aware how that's going to happen. So what's our routine right now? What is our experience here at Stages of Life? And we've been open throughout the entire crisis because our patients need hands-on care. Have we seen a bunch of people with COVID? The answer is no. We have a couple people that have stayed at home that we think may have been exposed. We're not really interested in having them come in to be tested yet. But we're not even seeing as much influenza as we did. So the social distancing has reduced the number of upper respiratory tract infections all the way around. Can you still catch a cold? And the answer is yes. Personal experience with that from handling things like the mail and groceries. Guess what? You can still catch a cold. The cold actually might be more infectious than COVID. At least that's been our general experience. So do you have anything to worry about out there? Okay, it depends on where you're sitting, depends on where you're standing and where you're working. A lot of people will still work from home. This is not a bad thing, provided you can maintain your level of productivity. Is that going to be an important thing? And the answer is, as a boss, you betcha. If you can get your job done, I don't care if you're here or you're there. You don't get your job done, you're gone. I will find somebody to replace you. So don't get lazy. Don't get complacent. Get your job done. Answer your phone. Do what needs to be done. Pretend not to be a state employee. Stay safe. What does this mean? It means wash your hands. This is something that we're going to do a lot more of. And in fact, we should have already done a lot more of it. I've done many a briefing like this talking about the yahoos that go into public restrooms, use them appropriately, and then don't wash their hands. They're the same people that go out and shake your hand. They're the same people that handle the door handles. They're the same people that drive your car for you if you have a valet. So you have to be aware to clean up after yourself and clean up before yourself. If you're going to go to the bathroom, wash your hands first, then go to the bathroom, and then wash your hands to follow. That is basic hygiene. The number of people that actually do that is disturbingly small. So what do you think? Do you think the schools will return first or work? Okay, well, I've been asked this question, and I'm going to answer it one more time. School is going to be the last thing to come back. And the reason is that if you think it's hard to get discipline out of adults, try to herd a bunch of kids. It is not going to happen. All right? If you give them brownies, it's even worse. So, no, let's keep the schools closed until next season. Okay, they're not going to benefit from a few weeks of hanging around. Let's get certain people back first. What do we need? What do we need the most of right now? Well, one, we need certain types of service industry personnel that are not currently around. It'd be nice to get the dentists back in business. It'd be very, very nice to get elective surgery back in business, because just because it's quote unquote non-essential doesn't mean that it's not essential. If you have a busted up knee, shoulder, hand, or whatever, and you're waiting to have it mended, now is a really good time to sit back and wonder, gee, what a great system we used to have. Okay, we'll talk about socialized medicine in another briefing today. So schools last. So who do we want to go back? From my perspective, it would be retail. Why? Because you can treat, you can serve, you can handle a lot of people in a clothing store without really making yourself or anybody else sick. And yet you do need clothing. You do need office supplies. You do need many things around the house that you're not able to get right now. So it'd be nice if they could open up these stores. Is that a problem? No, not if you maintain the social distancing, put the hand goo out there, make sure that everybody's doing what they're supposed to do, and then move on. Who else needs to go back? All right, well, so it might be the medical support people. Now, the administrators have long since abandoned ship. They're operating from home right now, leaving the nurses in the hospital to fend for themselves. And they will, in fact, send out nice emails. Good job. How the heck would you know? You don't even have cameras out there to watch them. So you're sitting around doing what you're doing from the safety of your own home. Lead from the front. Get up out of your offices at home. Go to your offices, in the hospital, and start glad-handing the people that have been keeping your business afloat. This is Dr. David Klein, trying to maintain discipline here as you're going to maintain discipline at your workplace when you return. Have a nice one. Bye.